Hello friends, I am Dr. Aditya GK, surgical gastroenterologist practicing in Bangalore. Today we will discuss one more clinical entity called asymptomatic gallstones. So you must have heard of gallstones, that is stones in the gallbladder. So most of the times you will be in a dilemma whether this gallbladder stone is problematic or it is silent. If you do not have symptoms means pain in your right side of the abdomen or pain at the back on the right side or in the right shoulder, or if you feel any heaviness in your right side of the abdomen, associated vomiting or frequent gastritis which you cannot differentiate with the pain. So if these symptoms are there, then it is a symptomatic gallstone. If you do not have any of these symptoms, it is an asymptomatic gallstone, which is also called a silent gallstone. So, if you look at the world population, around 80% of these patients are asymptomatic, and these stones are seen in 10 to 15% of general populations. That means if you take 100 people, among them 10 to 15 will have gallstones. So that huge number it is. So among them 80% are asymptomatic. That means 80% will not have any symptoms regarding their gallstones. So only 1 to 2% of these people become symptomatic over a period of 1 year. So that means 100 people if you take, among them 1 to 2 will become symptomatic. That means they'll start developing pain. So if then only they are called symptomatic gallstones, which requires addressing. So whether these gallstones become symptomatic in all? No. When you look at the literature, when these patients are followed up for years together, only 5% of them will become symptomatic at the end of 5 years. 15% will become symptomatic at the end of 10 years, and only 18% of them will become symptomatic at the end of 15 to 20 years. So that means the numbers are small. But the only concern which is there in almost all patients is that whether these gallstones can cause problems. Yes, they can. Not all gallstones are harmless. Some of the gallstones can cause trouble, but if you look at the number, the chances of people developing complications is very low. That is, less than 5% of these symptomatic patients can have symptoms. And most of the times, the complications like pancreatitis or jaundice or cholecystitis, all these complications will occur only after a warning sign of pain. If you ignore these warning signs of pain, then only you can land up in trouble. Otherwise, if you pick up these warning signs, they can be well addressed in time so that you will not develop any complication. One more concern among population is whether these gallstone can cause cancer. Yes. Strictly speaking, not all gallstones cause cancer, and when you look at the studies, again, the patients who had gallbladder cancer, 0.3 to 3% of them had gallstones. So there are certain factors of gallstone which can increase the possibility of cancer. That is, stone size more than 3 centimeter. That means a bigger stone, multiple stones, and the stones were there in the gallbladder for a very long time, and patients having family history of gallbladder cancers. Then some of the environmental and genetic causes can trigger a cancer element in these patients. But again, the incidence is very low. So why not get a surgery done for these asymptomatic gallstones? So doing a surgery, that is laparoscopic cholecystectomy, that is removing the gallbladder, is a simple procedure where patients will undergo a laparoscopic cholecystectomy. But what is the problem? So even whether the surgery is done in a symptomatic patient or an asymptomatic patient, the chances of the complications are the same. So if you want to avoid those complications, then you should not undergo surgery only and only if you are asymptomatic. If you are symptomatic, definitely you will require surgery. But keep that in mind. So you do not require surgery if you are asymptomatic. That does not mean that you are cured for life. Anytime you develop pain or any of those symptoms, you need to consult a surgeon, especially a gastrointestinal surgeon, to make sure that your gallbladder is not the culprit for your pain. So if you have pain in your abdomen, please consult your doctor. If you don't have pain or any of those symptoms, you can ignore getting a surgery done. But there are certain group of people where this gallbladder needs to be removed. We call it prophylactic cholecystectomy, which needs to be done in those patients where they live in an endemic area where there is higher chance of gallbladder cancer in that area, or in patients who have a family history, any of their family, close family members who had a gallbladder cancer, or in patients who can easily become symptomatic. Who are those patients who can become or have the higher risk of becoming symptomatic? Those patients who are having stones of more than 3 centimeter, or patients who are having stones of less than 3 mm, that means very small stones, very floating stones, and presence of multiple stones. So these are the factors where the patients can become symptomatic over a period of time, and in these patients a prophylactic cholecystectomy can be done. Otherwise, an asymptomatic gallstone does not require surgery, with a caution note telling that if you become symptomatic, get a pain abdomen, do not ignore it. Thank you very much for watching this video. Please educate your neighbors, your friends, so that they will not be in an unnecessary dilemma or anxious state about their gallstones anymore. Thank you so much.